Dr. Ken Landau, thanks for watching. Let's talk about Mybetriq or Mirabegron. This is a drug used to treat overactive bladder. It was developed and manufactured by a Japanese pharmaceutical company known as Astellas. It was given FDA marketing approval in 2012. It's advertised as the only drug in its class. There's no generic available. And interestingly, the Food and Drug Administration did give it marketing approval, but it voted 7-4 in the advisory committee in favor of the drug with one abstention, saying, well, probably the benefits are greater than the risk to the heart and to the liver. And the drug company actually has come back to the Food and Drug Administration in the latter part of 2017, asking that the FDA allow it to combine the Mybetriq with one of their older drugs, known as Vesicare, and market the two together. They anticipate that that will be approved and marketed by the latter part of 2018. Overactive bladder is an extremely common condition and might affect as many as 1 in 5 adults. Especially common in people who are over age 75, and although we think of overactive bladder as principally a female problem, happens a lot in men too, and 1/3 of the people who have overactive bladder are going to suffer from urinary incontinence. They're going to lose the urine before they get to the bathroom. If we try to define overactive bladder, well, it would seem that most people agree it's urinating 8 or more times a day, getting up 2 or more times at night to urinate, having the overwhelming sudden need to urinate, that's the urgency, and the urge incontinence is not being able to make it to the bathroom in time. This condition is uncomfortable and it's disruptive, and it's potentially serious. Serious because some women won't go out of the home. Some people can't sit in the meeting because they're embarrassed. It's important to realize this is not a normal part of the aging process. If we look at overall frequency in the general population, we find that probably around 14% of the people are going to be suffering from frequency. Urgency might be 8 to 10% of the population, and urge incontinence is as common as 4 to 7%. So we're talking about a condition that affects an awful lot of people. And while it's mostly middle-aged and older people, young women are not exempt. Now, the exact definition really has to do with some environmental factors as well. So you get up frequently to urinate if you happen to be taking a water pill, or if you have congestive heart failure, or if you happen to have diabetes that's not in control. You happen to get up a lot at night if you happen to have a couple cups of coffee before you go to bed, or a couple glasses of water. So we have to consider those things. And that means that for many people, alteration of your normal activities and treating other diseases may well improve your overactive bladder. And in fact, we know that about 1 person in 3 who suffers from overactive bladder is spontaneously going to improve. The condition can seem to come and go. Now, there are 2 different kinds of incontinence, as I mentioned. One, stress incontinence, that tends to occur in young women who have relatively weak urinary sphincter, a sphincter that separates the urethra from the outside. And this occurs, the incontinence occurs, when they increase the intra-abdominal pressure, a cough, a sneeze, a laugh. And that's what causes it. On the other hand, this urge incontinence has to do with the muscle of the bladder itself contracting when it shouldn't contract. It's not contracting because the bladder is full. The bladder could be half empty. And all of a sudden, for reasons we don't understand, the bladder wall just contracts. Tends to occur more in young women than old. Now, there are a lot of reasons why a person might go to the restroom or need to quite frequently. You might have a urinary tract infection, a kidney stone, maybe an enlarged prostate. Maybe you have some heart disease or kidney disease, liver disease. Maybe you have diabetes. Maybe you're taking a water pill. Maybe you just drink too much water, soda, coffee. Maybe you have multiple sclerosis or Parkinson's disease. All of those things need to be considered. Well, they advertise this drug quite frequently on the television. They have an ad where an animated bladder pulls a woman from directing a band, makes her go to the bathroom and says, you should ask your doctor if Myrbetriq is right for you. Well, under normal circumstances, when the bladder is about half full, you get some idea that it's time to consider going to the bathroom, but you don't necessarily have to. When you have overactive bladder, you have to. There is no question. Even with a partially filled bladder, the muscle wall contracts. We know that it can have to do with this beta-3 adrenergic agonist. That's the thing that Mybetriq works on. Well, it was first described, the chemical, in 1989. So we've known about it, the chemical, for a long time. This just happens to be the first time that a drug was manufactured that actually works on that particular activity. Now, it doesn't have anything to do with your normal voiding. Normal voiding doesn't have anything to do with this particular chemical. It's the bladder muscle contracting involuntarily before the bladder is full. That's what this drug supposedly works on. And it works in a different manner than the standard drugs. The standard drugs, we call them anticholinergics or antimuscarinics. Those are the drugs like oxybutynin and ditropan and that Vesicare. They work by relaxing the muscle in the bladder so that the bladder can fill even with more capacity before you feel the urge to go. Well, if we look at some of the studies, see how well the drug really does. So looking at women who've had overactive bladder for at least 3 months, they have at least 8 episodes of frequency, they have to go at least 8 times, they have urgency at least 3 episodes a day. We're talking about principally a Caucasian group of women who are 60 years old in these studies, and women were 3/4 of the people who were studied. About half of the women had previously taken one of the older drugs for overactive bladder. So, if we look at the number of incontinence episodes, so we said that the baseline was 2.5, 3 times a day they would lose urine before they got to the bathroom. With the placebo, they reduced that by 1 episode per day. On the other hand, if they took this drug, the overactive bladder medicine, Myrbetriq, they only reduced it by 1.5 times a day. But remember, we're starting off, you're going to the bathroom 3 times a day. What's the difference between the active drug and the placebo? About 1 episode every 2 days. That's unimpressive. What about when we're talking about the frequency? Well, baseline, the women who were studied in this population went to the bathroom 11 to 12 times a day. With the placebo, they reduced that by about 1 time a day. With Mybetriq, they reduced it by about 1.5 times per day. The difference between the two was half a urination a day, or 1 urination every other day, in somebody who's going to the bathroom 12 times a day? Doesn't seem very impressive. As far as capacity is concerned, well, the bladder capacity was increased by about 2 teaspoons in people taking the placebo and 3 teaspoons in people who were taking the medicine. So again, very unimpressive. We doctors, however, like to measure things, and we can measure a difference between the placebo and the active drug. On the other hand, you, the patient, you, the person who's taking the drug, you want to see some benefit. You want to improve the quality of your life. You want to have less bladder leakage. And this drug isn't all that strong in doing that. The trials actually were funded by the manufacturer. They're relatively short. Even on these short studies, only 12 weeks, about 20% of the people stopped taking the drug. And the drug isn't tested against any active drug. It's tested against an inactive placebo. So the benefits of the drugs are marginal, They all have some side effects. You get a little relief, but hardly anybody is completely relieved. On average, if we're talking about urinating 12 times a day and we reduce it by 1 or 2 times a day, that's not really all that impressive. And if we look at longer studies, by 6 months to 12 months, at least half of the people are going to stop taking the drug because it just doesn't impress them. And the Food and Drug Administration says that the drugs probably aren't of very much use, any of the drugs in this kind of family, and they actually require the Food and Drug Administration only requires a test against the placebo. So what does some of the organizations say? Well, the American College of Physicians and the American Urology Association, they recommend that these drugs aren't really the first choice. You ought to go and try some exercises, or you should try some other maneuvers rather than take the drugs. And the drugs are only moderately effective at best. All of them have some side effects. And the difference between choosing one drug versus another should probably be done on the basis of cost and likelihood of side effects, because they all work about the same. There isn't all that much difference between the drugs. And actually, the nonpartisan consumer reports looked at all of the drugs for overactive bladder and said, we don't recommend any of them, but if you're going to take one of them, probably the best one is the oxybutynin extended release, or maybe the tolterodine extended release. And the American Urology Association, again, recommends these drugs really only as second line, and the National Health Service in Great Britain recognizes them only as third line drugs. Now, if you're going to take the drug, you should take it with water. You don't chew the drug. You start off with 25 milligrams. You take it with or without food. Doesn't seem to make any difference. Could take you as long as 2 months to get the full benefit of the 25 milligram pill. They make a 50 milligram pill, that's the maximum dose. That might be effective within a period of about 1 month. Fortunately, the drugs last long enough time in the bloodstream so that you only have to take them once a day. And if you do that, you should make sure that you're not breastfeeding, because it's not good for the kid. Doesn't seem to make all that much difference when you're pregnant, but probably not while you're breastfeeding. Not tested in children. In older people seem to be okay, but you have to be careful because the drug inhibits the body's ability to metabolize other drugs. So for instance, if you're taking an antidepressant, dazipramine, or if you're taking metoprolol for your heart, those concentration of those drugs are going to increase markedly. So too with some of the heart arrhythmia drugs. So you do have to pay attention if you're taking this drug. Now, if you're taking the drug, come on, some common sense. Don't drink a lot of liquor. Stay away from some caffeine. Watch out how much liquid you're taking in the course of a day, how much salty food you're going to take. And all of the drugs have some side effects. They have side effects that are annoying, especially when you're not getting any benefit. Sometimes it could be nausea or diarrhea or constipation or headache or dizziness. Sometimes it might be an increase in your heart rate. They increase the heart rate on average by about 7 beats a minute. Some of the drugs, although not typically this one, can cause some dry mouth. They all can cause allergy. This one, the Myrbetriq, the side effect that it has is it might increase your blood pressure. Actually increases the blood pressure probably in 1 in 9 people. Now, for most people, it's only a little bit, maybe about 4 millimeters on the systolic side, but in about 5% of the people, it might be more than 15 millimeters. That's a significant increase. And if you happen to have narrow angle glaucoma, you might have an acute attack. And if you have bladder outlet obstruction as a guy with a prostate problem, theoretically, you might have obstruction. Now, the other drugs, the antimuscarinics or the anticholinergics, these are drugs like tolterodine or Vesicare or Enablix or Toviez. They seem to work just as well. So even though this drug, the Mybetriq, is advertising that it is a novel kind of a drug, so what? Doesn't seem to work any better. And now they're going to combine it with another drug that's only so-so. So they're going to combine the Vesicare 5 milligrams with the Mybetriq, which is going to be the 50 milligram form. And they hope to get that on the market in the United States by the latter part of 2018. Now, there are alternatives. And the alternatives include the Kegel exercises, some pelvic floor exercises, some bladder training that you can do. And you can go to the internet and you can find all sorts of bladder training that can be done. And then there are cones and bladder supports. And for some women, there might be Botox injections right into the bladder, or antidepressants, or maybe some calcium blockers, or some estrogen topically. If you happen to go the route of the Myrbetriq, well, you're going to pay a pretty penny for that. If you go and you want to plunk down some cash over at the drugstore, it's going to cost you $400 a month, or about $13 a pill. If you have a coupon, it's still going to cost you more than $10 a day to take this drug. So when it comes to people who have overactive bladder, the first thing that you should do is you consider some lifestyle modification. And then the second thing you should do is you should consider some appropriate exercises for the pelvic floor, and then some of the other medicines that might be effective. And then if you want to take a drug specifically for overactive bladder, probably you should stick with the original class, the anticholinergics or the antimuscarinics, unless the side effect profile is inappropriate for you. Because remember, no matter what they say, all of the drugs seem to work about the same way, and not very well. Anyway, thanks for watching. I'm Dr. Ken Landau.